Hi, Beth here from Menopause Manipulated No More. I want to talk about one of the most important myths the pharmaceutical companies spread about hormone products for menopausal women. The myth is that you can get hormone replacement therapy from currently available products. It's not true, and the pharmaceutical companies know it. The pharmaceutical companies know that every menopausal woman has a disease called profound hypogonadism, and they know they don't have a single product to treat it. Yes, you can get estradiol, but what dose makes it estradiol hormone replacement? What is the therapeutic range for estradiol? No one knows, because there's never been a clinical trial to look for it. Pharmaceutical companies know that two things have to be in place for a clinical trial to find the therapeutic level for estradiol. First, there needs to be an estradiol product. And second, it must be used simultaneously with testosterone and progesterone. Pharmaceutical companies know that estradiol will stimulate estrogen receptors, and they know that testosterone and progesterone suppress overall the stimulation of estrogen receptors. It's been proven that progesterone will suppress estrogen receptors in the uterus to prevent uterine cancer. And it has been proven that testosterone will suppress estrogen receptors in the breast to prevent breast cancer. So why do pharmaceutical companies irresponsibly and recklessly use estradiol without also making sure adequate amounts of progesterone and testosterone are present so healthy reference levels can be established? Pharmaceutical companies know how to provide successful hormone replacement products when they want to. Pharmaceutical companies provide successful hormone replacement products for thyroid, cortisol, insulin, growth hormone, and every other kind of hormone deficiency. So why do pharmaceutical companies irresponsibly and recklessly sponsor clinical trials that only use estradiol without testosterone and progesterone? Because they don't want profound hypogonadism to be successfully treated. Because they want menopausal women with profound hypogonadism to believe there is no HRT regimen that can treat this disease. This is why clinical trials fail, because estradiol, testosterone, and progesterone aren't used simultaneously in therapeutic ranges. In other words, actual HRT was never used. So what do pharmaceutical companies get out of menopausal women with profound hypogonadism not getting effective treatment? They get menopausal women with chronic profound hypogonadism and all the illness that goes with it. Having a chronic disease is a gift that keeps on giving to a pharmaceutical company. It shouldn't be this way. Women shouldn't be treated as cash cows, but that's the current reality. One day, therapeutic levels for the simultaneous use of ovarian hormones will be identified. Unfortunately, today isn't that day.